nation of India. Unfortunately, as you all know, since March, the COVID-19 pandemic has taken over literally our lives. Across the world, this pandemic has been affecting lives, livelihoods, the economy, basically everything. And Guyana is no exception. I must say that Guyana so far has been able to contain the disease to a certain extent. And for that, we must be thankful to the Almighty. India, since the beginning of this pandemic in March, has been taking very active steps to not only safeguard its population, but at the same time using its healthcare and pharma strengths to help the countries across the world. Our Prime Minister Modi has been very active in interlinking worldwide collaboration and cooperation so as to get together an action plan and also to supply much needed medical supplies, protective equipment and other healthcare facilities to friends, the countries across the world. So far, India has helped over 120 countries across the world, out of which we are actively helping all the Caribbean countries. I'm very happy to inform you that about 10 days back, I was able to hand over the government of India's aid of about $1 million to the government of Guyana, out of which we dedicated half the amount to procure 29 ventilators, which were most needed, as I was told by the health minister. Of course, the other half went to purchasing the PPEs, the other supportive equipment like masks, the gloves, the sanitizers and other equipment. India also is supplying the hydroxychloroquine tablets across the world, and we gifted 30,000 tablets to the government of Guyana to deal with the pandemic. You know, hydroxychloroquine forms a vital part of the anti-COVID-19 regime in India. And even though the numbers are rising in India, I must inform you that the rate of cure is very high. The rate of deaths is one of the lowest in the world. And for us, you know, with a population of 1.4 billion, we would have been in the high millions, the cases, but we have been only around 3.5 million, even though we are number 2 in the world. But the proportion of people affected continues to be very low. For that, I must thank the Indian healthcare system and the hospitals where we get good quality healthcare at cheap rates, which has also made India the center for world medical tourism. So when I was interacting with His Excellency and the President of Guyana and his team, one of the things that came up was further collaboration between India and Guyana. So as part of that, in the health sector, I am very glad to inform you that we have achieved significant progress in the project for upgradation of the Sadi Regional Hospital, which will be upgraded at a cost of around around $5.75 million. So this will be part of the 3 regional hospitals that we are upgrading, the other 2 being in Baltica and West Demerara. So this is part of the Government of India's efforts to upgrade healthcare across the region. Apart from that, as my friend from Bank of Baroda was mentioning, we are also actively working on various projects, some of which concern IT. For example, the Center for Excellence in Information Technology, which has been built in the University of Guyana, we have proposed to upgrade it to make it as the CARICOM Center for Excellence in IT, which will make Guyana into the regional hub for IT. we are working very closely with the Office of the Honorable Prime Minister on that. Thank you.
Reached out to us and donating in his donations along with other members of the Guyana Bank for medical supplies to our region, which is at this point is very, very important and instrumental for the well-being of our people. I'm the Vice President for the Essequibo Chamber of Commerce. Unfortunately, the President had another activity he had to attend to, so I will be making the remarks on behalf of the Chamber of Commerce. The world continues to battle with the terror of COVID-19 pandemic. One of the things we can be proud of, however, is the support extended by the private sector and various non-governmental bodies in this combat. Today, the Essequibo Chamber of Commerce is pleased to firstly welcome the Indian High Commissioner, Dr. Srinivasia and team, and secondly, wholeheartedly extend our gratitude to the Indian High Commissioner for their donation of medical supplies to Region 2. Like the ECCI, the work of the Indian government and the High Commissioner in Guyana in this fight against COVID-19 is highly commendable in reaching out to communities and providing support. Undoubtedly, the donations will contribute significantly to the COVID-19 fight within our region and also the protection of our front.
The COVID-19 pandemic has been so effectively contained here. Only thing we should not become complacent. The same adherence we have to continue until we ensure eventual victory over this disease. And as far as Bank of Baroda is concerned, just I would like to give you a brief background. It's a government of India owned bank, and we have been in Guyana since 1966. 31st March 1966 to be precise. Just almost 2 months before the country gained independence on 26th May. For last 54 years, our bank has been here without any issues. We have been serving the Guyanese community very well. And so with the new government taking over here, on 24th August, I had an opportunity to interact with His Excellency President Dr. Irfan Ali, and he also set out his priorities that the focus will be on development of economy through agriculture, through food processing, and like solar power, so as to enable the community across the country. And you see, Guyana and India both are the founding members of International Solar Alliance. So with the expertise of India in the solar power, that could be leveraged here in these distant locations for generating power, supplying, saving the electricity, that kind of spurring the economic activity. India is very strong in pharma sector. That expertise could be leveraged here. And in agriculture, food processing, in all those sectors, there are tremendous opportunities available. So, and with the limited population, the resources, the pressure of resources is very limited here. So the opportunities for growth are tremendous. And I can definitely say that you people are very blessed in a way that you have abundance of water, no pollution, then very neat and clean, less greenery, fertile land. So all the resources are
the RDC, His Excellency Dr. Srinivasan, High Commissioner of India, Mr. Gupta, Managing Director, Bank of Baroda, Ms. Swan, Vice President of ECCI, distinguished guests, colleagues, and members of the task force for region number 2. The task is mine to say hearty thank you to the High Commissioner of India, Bank of Baroda, and also the ECCI and all the other stakeholders who would have contributed in a timely manner for the fight against this country. And once again, on behalf of the regional administration, the regional task force, all the stakeholders, and of health services especially, we would like to say thank you and do come again to our region. It's a beautiful region.
Stamps that we printed for the 150th anniversary of Mahatma Gandhi.
Again.
Namaste.